Have you ever looked at two people, both with an autism diagnosis, and thought, how can they be so different? Well, we're going to get into that because the answer is absolutely fascinating, and it really gets to the heart of what the spectrum is all about. You know the scene, right? You might meet one autistic kid who's nonverbal and needs a lot of hands-on help, and then you meet another who can talk your ear off about astrophysics. They've got the exact same diagnosis on paper. So, what gives? Look, you're not imagining it. This incredible diversity isn't the exception, it's the rule. And once you understand why it happens, it kind of changes everything. It changes how we see, how we understand, and how we support people. So, let's break it all down. Okay, first things first, let's get on the same page. The CDC calls autism spectrum disorder, or ASD, a developmental disability that comes from differences in the brain. Now, that word, spectrum, it's not just a nice-sounding term. It is everything. It's the whole key to this puzzle. So when a professional is making a diagnosis, they're looking for a specific combination of traits that fall into two main buckets. You can think of these as the two essential building blocks. And here's the thing you've got to remember. Every single person with autism has their own unique recipe, their own blend of these two things. So one person might have a really hard time with back-and-forth conversation, but their repetitive behaviors are pretty mild. Somebody else might be a social butterfly but have super intense interests that take up all their focus. The combination is always different. Now, to try and capture some of this variety, the diagnosis often includes what are called levels of support. But, and this is a big but, there's a really important catch you need to know about these levels. The official guidebook, the DSM-5, lays out 3 levels. Level 1, which is requiring support, Level 2, requiring substantial support, and Level 3, requiring very substantial support. Really, this is just meant to give a general idea of the kind of help a person might need with their challenges right at that moment of diagnosis. And this right here, this is probably the single most important thing to understand about those levels. They are not a life sentence. They're not a permanent brand. It's just a snapshot, a picture of one moment in a person's life. That's it. Because think about it. A person's needs are always changing, right? They learn new coping skills. They move to a new classroom that's a better fit. Or maybe they're just having a really tough day. The support they need can go up and down. That kind of fluidity is totally normal. But wait, there's more. The story of what makes each person unique goes even deeper than the official diagnosis. We're about to look at a piece of the puzzle that shows a really surprising disconnect between different skills. So let me ask you this. You'd probably assume that if someone has what we call severe autism symptoms, they'd automatically need a ton of support with everything else, right? Like with learning or daily chores. It just seems logical. But is it actually true? Okay, so take a look at this. This is based on real research. Look at Child A. They have severe autism symptoms, but their cognitive skills? Totally in the average range. Now look over at Child B. Their autism symptoms are considered moderate, but they need a whole lot of support with cognitive and daily living skills. It shows so clearly that these things are not tied together like we think they are. And that's the big takeaway here. A person's autism symptoms, their cognitive abilities, and their daily living skills, they're all different pieces of the puzzle. You absolutely cannot look at one piece and know what the other pieces are going to look like. It's a completely individual profile. All right, so let's tie all of this together now. When you put all these pieces on the table, what does it tell you? Well, it tells us we need a totally new mental image for what the spectrum actually is. Because what makes each person's autism unique is this incredible constellation of factors. We're talking about their social style, how sensitive they are to lights and sounds, their language skills. Then you add in things like anxiety or ADHD, which are super common. And of course, you have their intellectual ability and, so important, their unique passions and amazing strengths. This is exactly why thinking of autism as a line from a little bit autistic to very autistic is just wrong. It doesn't work. A much better way to picture it is like a sound mixing board in a recording studio. You know, each slider is a different trait. Social skills, sensory needs, language. And for every single person, all of those sliders are set to a completely different, unique level. And that leads us to the final, most important shift in our thinking. When we really get all this, we realize that asking, how autistic is someone, is the wrong question. It's not about ranking them. The real question, the better question, the one that actually helps is this. What support does this individual person need to thrive?